Have you ever heard of Papillon-Lefèvre Syndrome? It's one of those rare genetic disorders that often flies under the radar, but it's a condition that carries significant implications for those who have it. Papillon-Lefèvre Syndrome, often abbreviated as PLS, is a condition inherited in an autosomal recessive manner. This means that for a child to develop PLS, both parents need to contribute a defective gene. It's a disorder that primarily affects the skin and the immune system, leading to a host of unusual symptoms. Now, what does Papillon-Lefèvre syndrome look like? The most noticeable symptoms are often the skin-related ones. PLS patients typically develop a condition called palmoplantar keratoderma. In plain English, this means that the skin on the palms of the hands and the soles of the feet becomes thickened and rough, often cracking painfully. This can start as early as the first few months of life, sometimes taking a few years to fully develop. But PLS doesn't stop at the skin. It also affects the teeth. You see, the immune system in PLS patients struggles to handle bacteria in the mouth properly. This often leads to severe periodontal disease, causing the teeth to become loose and fall out. This can happen as early as the age of 3 or 4, and by the time the patient reaches their teenage years, they may have lost all their primary and permanent teeth. For those living with PLS, life can be challenging. But it's not all doom and gloom. There are treatments available that can help manage the symptoms. For the skin issues, creams and ointments that contain urea or salicylic acid can help to reduce the thickness of the skin. In more severe cases, oral retinoids may be used. To tackle the dental problems, a rigorous oral hygiene regime is often recommended, along with regular dental checkups. Antibiotics can also be used to control the bacterial infections that lead to periodontal disease. In some cases, dental implants may be considered once the patient's jaw has fully grown. But how common is Papillon-Lefèvre syndrome? Well, it's estimated to affect about 1 in a million people worldwide. So while it's not a common condition, it's still a significant one for those who have it. In summary, Papillon-Lefèvre syndrome is a rare genetic disorder that primarily affects the skin and the immune system, leading to thickened skin on the hands and feet, as well as severe dental problems. It's a challenging condition to live with, but with the right treatments and care, the symptoms can be managed effectively. It's important to remember that every person with PLS is different, and what works for one person may not work for another. But with continued research and understanding, we can hope to improve the lives of those living with this unique condition.